Hey everyone, and welcome back. We're about to jump into another deep dive, and this time we're going to tackle something pretty incredible.
Oh, yeah.
Pregnancy.
Definitely incredible.
Yeah. It's one of those things that, you learn about it in nursing school, but like it's so complex. And I think a deep dive is really going to help us all appreciate just how amazing this process is.
Yeah, totally. I mean, every system in the body is affected. It's just wild how it all works together.
Right. It really is this like beautiful orchestration of all these changes.
A symphony of physiology.
Yeah, exactly. So let's imagine you're a nurse and a patient comes in and, maybe she's missed a period. Maybe she's having some other symptoms.
Okay.
How do you really know if someone is pregnant?
Right. Well, it's kind of like detective work. We look for clues and we categorize them into three types. Presumptive, probable, and positive.
Okay, break those down for me.
So presumptive signs are things that the woman herself feels like, oh, I'm so tired, or my breasts are really tender, or oh, I have the morning sickness.
Yeah, those are the classic ones, but those could be from other things too, right?
Exactly. That's where the probable signs come in. Those are more objective, things we can measure or observe.
Okay, well, listening.
So like a positive pregnancy test would be a probable sign, or changes in the uterus. Even those Braxton Hicks contractions, those irregular ones.
Oh, yeah. Those can start super early, can't they? I remember learning about that in school.
Yeah, sometimes even in the first trimester. But even probable signs aren't 100% definitive. There are some conditions that can mimic pregnancy.
So we need that gold standard, those positive signs.
Right, and those are the ones that give us that absolute confirmation, like seeing the fetus on an ultrasound or hearing that heartbeat or feeling those fetal movements.
It's amazing to think that we can actually see and hear that little one growing inside.
It really is. It never gets old.
So once we know for sure someone's pregnant, it's like, buckle up, buttercup, because things are going to change big time.
Oh, yeah. Get ready for the ride. We're talking changes in every single system. It's pretty wild.
Okay, so let's start with something pretty dramatic. The blood volume. I've heard it increases a lot during pregnancy.
It does. It can go up by as much as 50%. That's like carrying around an extra 1.5 liters of blood.
Wow, no wonder pregnant women feel swollen sometimes.
Yeah, that's definitely part of it. And all that extra blood puts a strain on the heart, too. Cardiac output goes up significantly to keep up with the demand.
So the heart is working overtime. Does that also explain why they might get short of breath?
It's part of the reason. The growing uterus also pushes up on the diaphragm, making it harder for the lungs to fully expand.
Right, and of course they're breathing for 2 now, so the demand for oxygen is higher overall.
Exactly. So yeah, it's not uncommon for pregnant women to feel a bit winded, especially later in pregnancy.
Speaking of blood, does the composition of the blood change at all during pregnancy?
It does. It's actually pretty fascinating. Even though red blood cell production increases, it doesn't quite keep up with that expanding plasma volume.
So he's saying that pregnant women become anemic?
Well, sort of. It's what we call physiologic anemia of pregnancy.
So it's like a normal adaptation and not necessarily a cause for concern.
Exactly. It's important to distinguish this from iron deficiency anemia, which is a different issue.
Okay, that makes sense. But speaking of iron, pregnant women don't need more of it, right?
Yeah.
To support that increased blood volume and the baby's growth.
You got it. Iron is super important, and it's one of the reasons why prenatal vitamins are so crucial.
Yeah, it's pretty much impossible to get all that extra iron from diet alone.
Right. And there are other key nutrients, too, like folic acid. That one's super important for preventing neural tube defects.
Yeah, we know that folic acid is essential, especially during those early weeks of development. It's a good reminder to emphasize prenatal care even before conception, if possible.
Absolutely. Early intervention is always best.
So we've talked about blood, but what about the star of the show, the uterus? I mean, that thing grows from the size of a pear to accommodating a full-term baby and placenta and all that amniotic fluid. It's crazy.
Yeah, it's pretty mind-blowing how much it can expand. And then after delivery, it shrinks back down again. It's just incredible.
The human body is amazing.
It truly is. And those changes in the uterus are what allow us to measure fundal height to track the baby's growth and estimate gestational age.
Oh, right. Fundal height. That's a key assessment during prenatal visits. And speaking of changes, have we talked about Braxton Hicks contractions yet?
Yes, the practice contractions. Those can start surprisingly early, even in the first trimester.
I remember learning about those in nursing school. They can really catch first-time moms off guard.
Definitely. But it's important to reassure them that they're normal and usually painless.
Good point. Okay, so we've covered the blood, the heart, the lungs, and the uterus. What about the digestive system? Does pregnancy make things a little rough for that system?
You could say that. Progesterone, which is essential for maintaining pregnancy, also has some interesting effects on the digestive system.
Interesting in like a good way or a bad way?
Well, it depends on how you look at it. Progesterone slows down the digestive process, which can lead to things like constipation and heartburn.
Ah, so that's why so many pregnant women are reaching for the Tums.
Exactly. And it can affect the gallbladder, too, sometimes leading to gallstone formation.
Wow, those hormones are really running the show, aren't they? Orchestrating all these changes for better or worse.
They are. And speaking of organs that have to adapt, let's talk about the kidneys. They actually enlarge during pregnancy and filter more blood.
So they're working extra hard to keep up with all the demands. No wonder pregnant women are always running to the bathroom.
That's true. And that increased filtration isn't just about getting rid of waste products. It's also about maintaining a healthy balance of electrolytes and fluids for both mom and baby.
Wow, it's like everything is connected.
It really is. Here's a fun fact. It can actually take months for the kidneys to go back to their normal size postpartum.
Months.
Yeah.
That's amazing. The body really goes through some remarkable changes during pregnancy and even after delivery.
Absolutely. It's a process that continues long after the baby is born.
Okay, so we've talked about the blood, the heart, the lungs, the uterus, the digestive system, and the kidneys. What's next on our whirlwind tour of pregnancy adaptations?
Well, how about we shift gears and talk about the musculoskeletal system?
Oh, yeah, pregnancy and back pain. I've heard all about that.
Right. As the pregnancy progresses, the ligaments that hold the joints together start to soften and stretch. This is due to a hormone called relaxin.
Relaxin. Does exactly what it says on the tin, huh?
Pretty much. But all that laxity can lead to some aches and pains, especially in the lower back.
And then there's that waddling gait that many pregnant women develop.
Yep, that too. And lordosis, that exaggerated inward curve of the lower back.
It's amazing how the body adapts to that growing uterus and shifting center of gravity.
It really is. It finds these clever ways to compensate and keep things running smoothly, even with all these changes happening.
It's a marvel of engineering. Now, what about the integumentary system? I've heard all sorts of things about pregnancy glow and stretch marks. What's the truth behind those?
Well, first of all, that pregnancy glow is real. It's due to increased blood flow to the skin, which can make it appear more radiant.
So there's some truth to the myth.
There is. But on the flip side, many women experience hyperpigmentation, leading to dark patches on the face and that linea nigra down the abdomen.
Okay, so it's a bit of a trade-off. Glowing skin, but with some added pigmentation. And then, of course, there are the stretch marks. Are those really inevitable?
They're certainly common, affecting about 90% of pregnant women. As the skin stretches to accommodate that growing belly, those connective tissues can tear, leading to those reddish-purple streaks.
So those creams and lotions that promise to prevent stretch marks are probably just wishful thinking.
There's no magic bullet, unfortunately. But the good news is that stretch marks often fade significantly after delivery.
That's good to know. Okay, so we've covered the musculoskeletal system and the skin. Now let's move on to the endocrine system. I mean, it's like the master conductor of the pregnancy orchestra, right?
Absolutely. Pregnancy is a time of major hormonal upheaval, and the endocrine system is calling all the shots.
So we've already talked about estrogen and progesterone, but what are some of the other key players in this hormonal symphony?
Well, there's human chorionic gonadotropin, or HCG for short.
Oh yeah, HCG. That's the hormone that pregnancy tests detect, right?
You got it. It's produced by the developing placenta and basically signals to the body that, hey, pregnancy is happening. It's responsible for maintaining that corpus luteum early on, which keeps those progesterone levels up.
So it's like a chain reaction of hormones, each one playing its part.
Exactly. And then we have human placental lactogen, or HPL, which helps to prepare the breasts for lactation and regulates the mom's metabolism.
So it's all about supporting the baby's growth and development.
Right, and we've already talked about relaxin, the multitasking hormone that softens ligaments, prepares the cervix, and does so much more.
Yeah, relaxin's a busy one. What about the thyroid gland? Does that change during pregnancy?
It does. It actually becomes more active, producing more thyroid hormone, which is crucial for the baby's brain development.
Wow, so the mom's thyroid is actually contributing to the baby's development too.
Yep, it's pretty amazing.
It really is. So the thyroid's busy, the hormones are raging. What about the pancreas?
Oh, the pancreas definitely has its work cut out for it during pregnancy. Insulin and glucose regulation are super important, especially with all those increased demands.
Right, because the baby needs a lot of glucose to grow.
Exactly. And that can make it a bit tougher for the mom to regulate her blood sugar, which is why gestational diabetes is a concern.
Yeah, the placenta produces hormones that can make the mom's body more resistant to insulin, so the pancreas has to work even harder.
Right. It's a delicate balancing act, and one of the reasons why monitoring blood sugar is so crucial during pregnancy.
It makes you appreciate just how much is going on behind the scenes.
It really does. Now, what about the adrenal glands? Do they get involved in the pregnancy party too?
Oh, I'm sure they do. Those glands are like the stress responders, right?
Exactly. And pregnancy is definitely a time of increased stress on the body. So the adrenal glands are working overtime, producing higher levels of cortisol and aldosterone.
Cortisol makes sense, but what about aldosterone? What's its role in all of this?
Aldosterone helps regulate salt and water balance. During pregnancy, it plays a crucial role in managing fluid retention, which, as we've discussed, is pretty common.
Oh, right, because of that increased blood volume.
Exactly. Aldosterone is like the traffic cop keeping those fluid levels in check.
Okay, aldosterone is on the job, keeping things flowing smoothly. What about those little chemical messengers? Prostaglandins. I remember learning about them in pharmacology, but I can't quite recall what they do.
Oh, prostaglandins are fascinating. They have a starring role in softening the cervix and preparing it for labor.
Oh, wow. So they're not just involved in inflammation, they actually help with childbirth.
They do. They're crucial for getting that cervix ready for the big event.
Incredible. And speaking of crucial players, what about the pituitary gland? It's like the CEO of the endocrine system, right?
You got it. And it's definitely calling the shots during pregnancy, producing a whole slew of hormones that are specifically geared towards pregnancy and lactation.
So like prolactin, the hormone that stimulates milk production.
Exactly. The body is already preparing for breastfeeding long before the baby even arrives.
That's amazing. And what about oxytocin? Isn't that the love and bonding hormone?
It is, and it plays a crucial role in labor contractions and milk ejection during breastfeeding.
So it's not just about warm, fuzzy feelings. It's actually involved in some pretty important physiological processes.
Exactly. Oxytocin is a powerful hormone that really helps with that mother-baby bond.
This deep dive into the endocrine system is mind-blowing. It's incredible how many hormones are involved, each one playing its part in this intricate symphony of life.
It's a symphony worth marveling at. And speaking of amazing systems, we haven't even touched on the immune system yet.
Oh, right, the immune system. I imagine it has to walk a tightrope during pregnancy, protecting the mom from infections, but also avoiding attacking the fetus.
You're exactly right. It's a fascinating balancing act. The immune system undergoes a sort of shift during pregnancy, boosting the innate immune system while toning down the adaptive immune system.
So it's like the body is prioritizing the baby's survival, even if it means making the mom a little more vulnerable to some infections.
That's right. It's a remarkable adaptation that allows for the peaceful coexistence of mom and baby.
It's amazing how the body can do that. This is all so fascinating. We've covered so much from the heart and lungs to the uterus and kidneys, from skin and hormones to the balancing act of the immune system. It really highlights just how adaptable the human body is.
It truly is a marvel of nature.
Okay, so we've talked about a lot of systems, but we can't forget about another crucial aspect of pregnancy nutrition.
Yes. You are what you eat, as they say, and that's especially true during pregnancy.
So let's talk food. What are the key things pregnant women need to know about nutrition?
Well, it's not just about eating more, it's about eating the right things. Pregnant women need to make sure they're getting enough calories to support their own needs and the baby's growth. But it's also crucial to focus on the quality of those calories.
Right, so we're talking about a balanced and nutritious diet with plenty of fruits, vegetables, whole grains, lean protein, and healthy fats.
Exactly. It's all about providing the building blocks for a healthy pregnancy.
Okay, so balanced diet check. But how much weight should a pregnant woman gain? I've heard so many different recommendations.
Yeah, it can be confusing. The recommendations have evolved over time, and now they're tailored to the woman's pre-pregnancy BMI.
So there's no one-size-fits-all answer.
Right. For women who start pregnancy at a healthy weight, the recommended weight gain is typically between 25 and 35 pounds.
Okay, so there's a range depending on individual factors.
Yeah.
But it's not just about fat, right? The weight gain also reflects the growth of the baby, the placenta, and all those other changes we've talked about.
Exactly. It's a whole body transformation fueled by the right nutrients. And speaking of nutrients, protein is one of the most important ones during pregnancy. It's essential for building and repairing tissues, and the baby needs a lot of it to grow.
So pregnant women should be loading up on protein. What are the best sources?
Good sources include lean meats, poultry, fish, beans, lentils, tofu, nuts, and seeds.
Got it. Plenty of options there. And of course, we can't forget about iron, which is so important for supporting that increased blood volume and the baby's developing tissues.
Absolutely. Prenatal vitamins are key for making sure pregnant women are getting enough iron. But it's also important to encourage iron-rich foods like red meat, leafy green vegetables, and fortified cereals.
Okay, so iron and protein. And we've already talked about folic acid. It's important to emphasize that women should be getting enough folic acid even before they become pregnant.
You're absolutely right. Folic acid is crucial from the very beginning. And a few other nutrients deserve special attention during pregnancy: calcium, vitamin D, and omega-3 fatty acids.
Okay, let's break those down. Calcium's important for strong bones.
Exactly. And vitamin D helps the body absorb calcium, so they work together as a team.
And omega-3s are good for brain development.
You got it. Dairy products are great sources of calcium and vitamin D, while oily fish like salmon are packed with those beneficial omega-3s.
Okay, so lots of dairy and salmon. Makes sense. But aren't there some concerns about fish during pregnancy?
You're right. Some types of fish, like swordfish king mackerel and shark, contain higher levels of mercury, which can be harmful to the developing baby.
So it's best to choose low-mercury options like salmon shrimp and canned light tuna.
Exactly. Moderation is key, as with most things in life.
Good advice. And while we're on the topic of moderation, let's talk about caffeine.
Ah, yes, the caffeine question. Can pregnant women still enjoy their morning cup of joe?
That's the million-dollar question.
Well, moderate caffeine intake is generally considered safe, but it's important to keep it within reasonable limits. The current recommendation is to limit caffeine to no more than 200 milligrams per day, which is about the amount in a 12-ounce cup of coffee.
Okay, so a little bit of caffeine is okay, but don't go overboard.
Exactly. Now, I know we've thrown a lot of nutritional information your way, but it's all about empowering pregnant women to make informed choices about their diet and lifestyle.
Right, and it's our job as nurses to provide that education and support.
Well said. And I think we've covered a lot of ground here. It's amazing how the body adapts to support a growing human.
It really is. Pregnancy is such a fascinating process. All right, welcome back, everyone. I hope you all had a chance to catch your breath after that whirlwind tour of pregnancy adaptation.
Seriously, we covered a lot of ground in part 1.
We did, but as amazing as all those changes are, pregnancy isn't always a walk in the park.
Right. There can definitely be bumps along the way.
So in this part, we're going to shift gears a bit and talk about some of the complications that can arise during pregnancy.
Yeah, it's important to be aware of those potential challenges.
It is. So where should we start with such a vast topic?
Well, I think a good place to begin is with the placenta.
Okay, the placenta, the lifeline between mom and baby.
Exactly. It's responsible for delivering oxygen and nutrients and removing waste products.
It's like the ultimate support system.
Right. But sometimes things can go wrong with the placenta, and that can lead to complications.
Like placenta previa, for example.
Ah, yes, placenta previa. That's when the placenta partially or completely covers the cervix.
Right. I remember learning about that in nursing school. It can cause bleeding during pregnancy and even during labor.
Exactly. It's a serious condition, but thankfully not super common.
Okay, so placenta previa is definitely something to be aware of. Are there any other placental complications we should be familiar with?
Yeah, another one is placental abruption.
Placental abruption. That sounds scary.
It can be. It's when the placenta detaches from the uterine wall prematurely.
So it's like the placenta's peeling away.
Yeah, kind of. And that can disrupt the baby's oxygen supply and lead to some serious complications for both mom and baby.
That sounds really dangerous. Are there any warning signs for placental abruption?
The most common one is vaginal bleeding, but sometimes there's no bleeding at all.
So how would you know if it's happening?
Well, there can be severe abdominal pain, back pain, and uterine tenderness.
So basically, any sudden or intense pain in that area should raise a red flag.
Exactly. It's crucial to recognize those signs and act quickly. Prompt medical attention can make a huge difference in outcomes.
Okay, so placental issues are definitely something to watch out for. Now, what about the baby itself? Are there complications that can arise with its growth and development?
Yeah, unfortunately. One concern is intrauterine growth restriction, or IUGR for short.
IUGR, that's when the baby doesn't grow as well as expected, right?
Right. It can happen for a variety of reasons, including placental problems, maternal illnesses, and certain infections.
So if a baby isn't measuring as expected during prenatal checkups, that could be a sign of IUGR.
Exactly. That's why those regular prenatal visits and ultrasounds are so important. They help us detect any potential problems early on.
Okay, so monitoring and early detection seem to be key themes here.
They are. Early intervention often leads to better outcomes. And it's not just about growth restriction. We also need to be aware of the possibility of birth defects.
Right. Birth defects. That's a tough one. It must be so hard for parents to cope with that kind of news.
It can be incredibly challenging. But as nurses, we can provide support and guidance. We can help parents understand the different types of birth defects, the potential causes, and the available testing and treatment options.
It's about being there for them emotionally and providing them with the information they need to make informed decisions.
Exactly. Now let's shift gears a bit and talk about maternal health conditions that can complicate pregnancy.
So now we're talking about how pregnancy can affect the mom's health, not just the baby's.
Right. Pregnancy can put a lot of stress on the body, and that can exacerbate existing conditions or even trigger new ones.
Like gestational diabetes, for example.
Yeah, gestational diabetes is a big one. It's when the body becomes less responsive to insulin, leading to high blood sugar levels.
And if it's not managed carefully, it can increase the risk of complications for both mom and baby.
Right. It can lead to a larger baby, which can make delivery more difficult. And babies born to mothers with gestational diabetes are also at risk for hypoglycemia after birth.
So it's really important to monitor blood sugar levels closely throughout pregnancy.
Absolutely. Now, another condition that can arise during pregnancy is preeclampsia.
Preeclampsia. I know that one can be serious. Can you remind me what it is exactly?
Sure. Preeclampsia is a condition that develops after 20 weeks of pregnancy, and it's characterized by high blood pressure and protein in the urine.
And it can affect multiple organ systems, right?
It can. If it's not managed properly, it can lead to seizures, stroke, and even organ failure.
That sounds terrifying.
Yeah.
Are there any warning signs we should be looking out for?
Preeclampsia often develops gradually, so those regular prenatal checkups are crucial for catching it early. But there are some red flags to watch out for, like severe headaches, vision changes, sudden weight gain, and swelling, especially in the hands and face.
So any sudden or drastic changes should be taken seriously?
Absolutely. It's vital to educate our patients about those warning signs and to encourage them to report any unusual symptoms right away.
So early detection is key, just like with so many other pregnancy complications. I imagine the preeclampsia can also make labor and delivery more challenging.
Definitely. Women with preeclampsia are at increased risk for preterm labor placental abruption and other complications.
So it's a condition that requires careful monitoring and management.
It is. Now, we've talked about gestational diabetes and preeclampsia, but pregnancy can also worsen existing conditions like asthma, hypertension, and heart disease.
Right, because it puts so much extra stress on all those systems.
Exactly. It's like a stress test for the whole body.
So it's crucial for women with pre-existing conditions to be monitored closely throughout their pregnancy.
Absolutely. That's why comprehensive prenatal care is so vital. It's not just about monitoring the baby's growth. It's about assessing the mom's overall health and addressing any potential problems promptly.
It's about taking a holistic approach to pregnancy care.
Precisely. Now, we've covered a lot of ground in terms of potential complications, but there's one more we need to discuss: preterm labor.
Preterm labor. That's when labor begins before 37 weeks of pregnancy, right?
Right. And it's a major cause of complications for babies.
Because those babies are born too early and their organs might not be fully developed.
Exactly. They often require specialized care in the NICU, and unfortunately, there's no single cause of preterm labor. It can be triggered by a variety of factors, including infections, multiple gestations, chronic maternal illnesses, and even stress.
So it's not always preventable.
It's not. But we can try to reduce the risk by encouraging women to maintain a healthy weight, eat a nutritious diet, avoid smoking and alcohol, and manage any chronic health conditions carefully.
And of course, seeking prompt medical attention if any signs of preterm labor occur.
Absolutely. Early intervention is key.
Okay, so we've talked about placental complications, problems with fetal growth and development, maternal health conditions, and preterm labor. It seems like there's a lot that can potentially go wrong during pregnancy.
There is. But it's important to remember that the vast majority of pregnancies have positive outcomes. Most babies are born healthy, and most women experience a relatively smooth journey.
That's good to hear. It's easy to get caught up in all the what-ifs and potential problems.
It is, but it's important to maintain a balanced perspective and to focus on providing the best possible care for all our patients.
I agree. And speaking of care, I think it's time to talk about the different models of care that are available for pregnant women.
Okay, great. Let's delve into that.
So what are the main options for pregnant women when it comes to choosing a care provider?
Well, one of the most common models is the traditional medical model, where care is primarily provided by an obstetrician in a hospital setting.
Right. That's the model that most people are familiar with.
It is. This model offers access to a wide range of medical interventions and technologies, which can be life-saving in certain situations.
Makes sense. So if there are complications or if the pregnancy is high risk, this model can provide that extra level of care.
Exactly. But there are other models of care, too, that might be a better fit for some women.
Like midwifery care, for example.
Yes, midwifery care is becoming increasingly popular. Midwives are trained healthcare providers who specialize in pregnancy, labor, and delivery for low-risk pregnancies.
So they focus on the natural process of childbirth.
They do. They often provide care in a more holistic and personalized way, with a greater focus on education, emotional support, and shared decision-making.
So it's a more hands-on approach with an emphasis on empowering the woman.
Exactly. Midwifery care is often associated with lower rates of medical interventions like cesarean sections and episiotomies.
That's interesting. So it's not an all-or-nothing choice between the medical model and midwifery care.
Right. Women have options and they can choose the model that best aligns with their preferences and risk factors.
It's all about having choices and feeling empowered to make decisions about your own care.
Absolutely. And that brings us to another crucial aspect of pregnancy care, informed decision-making.
Informed decision-making. What does that mean in the context of pregnancy?
It means that women should be active participants in their own healthcare. They should have access to evidence-based information and the freedom to make choices that feel right for them.
So it's not about blindly following doctor's orders.
Right. It's about having open and honest conversations with healthcare providers about the risks and benefits of different procedures and interventions and feeling confident in the decisions they make.
It's a partnership between the woman and her healthcare team.
Exactly. A collaborative approach where everyone is working together to achieve the best possible outcome.
I love that. Now, what are some specific decisions that women might face during pregnancy?
Well, one common decision is whether or not to have prenatal genetic testing.
Oh, yeah, those tests can screen for various genetic conditions in the baby.
They can. And while they can provide valuable information, they also come with some heavy emotional weight.
Right, because it's not just about the test results themselves. It's about what those results might mean for the future.
Exactly. And that's why providing unbiased information and support is so crucial. We as nurses can help parents understand the different testing options, the potential risks and benefits, and the implications of the results.
So it's about empowering them to make informed choices that feel right for their family.
Exactly. Another decision that often comes up is whether or not to have an epidural during labor.
The epidural debate. I remember that one from nursing school.
Right. Epidurals are a great option for pain relief during labor, but they also come with some potential risks and side effects.
Like slowing down labor or increasing the need for interventions.
Right, so it's important to have honest conversations with women about the pros and cons so they can make a decision that aligns with their pain management preferences.
Again, it's all about individualizing care and respecting the woman's choices.
Absolutely. And then, of course, there's the big decision about the mode of delivery, vaginal birth versus cesarean section.
Right. While most women hope for a vaginal birth, there are situations where a C-section becomes necessary.
Exactly. It might be medically indicated for the safety of mom or baby, or it might be the woman's choice based on her individual circumstances.
Either way, it's a decision that shouldn't be taken lightly.
It shouldn't. And we need to remember that things don't always go according to plan.
That's so true. Childbirth is unpredictable, and we need to be prepared for the unexpected.
Absolutely. Flexibility and adaptability are key skills for nurses working in labor and delivery.
I agree. We need to be able to think on our feet and adjust our care plans as needed.
Exactly. Now, we've talked about various complications, models of care, and informed decision-making. It's been a lot to digest.
It has. But I think it's important to emphasize that despite all the potential challenges, pregnancy is a remarkable and transformative experience for most women.
I agree. Most babies are born healthy, and most women experience a relatively smooth journey.
It's a good reminder to focus on the positive while still being prepared for the unexpected.
Exactly. And it's also important to remember that each pregnancy is unique. There's no one-size-fits-all approach to care.
Right. We need to tailor our care plans based on the specific needs and circumstances of each patient.
Absolutely. Individualized care is key.
And we're back. So in the first two parts of this deep dive, we've really delved into the incredible physical changes that happen during pregnancy and even some of the potential complications that can arise.
We've covered a lot of ground.
We have. But, as fascinating as all that is, pregnancy is more than just a physical journey.
Oh, absolutely. There's a whole emotional and social dimension to it that we can't ignore.
Exactly. So in this final part, let's shift our focus to those aspects of pregnancy, the emotions, the relationships, the impact of society and culture.
I'm excited to dive into that.
Me too. So let's start with the emotional landscape. What are some of the common emotions that women experience during pregnancy?
Well, one of the first things women often notice is the sort of wave of mixed emotions.
Mixed emotions.
Yeah, even if the pregnancy was planned, there can be this sense of like excitement and anticipation, but also anxiety and maybe even some doubt.
Right, that ambivalence we talked about earlier. It's such a normal reaction to such a huge life change.
It is. And yet there's often this pressure for pregnant women to be like happy and glowing all the time.
Oh, yeah, like they should be radiating joy 24/7.
Exactly. Which can make it hard for women to express their true feelings, especially if they're having moments of, fear or uncertainty or even resentment.
Absolutely. It's so important for us as nurses to create that safe space for women to share whatever they're feeling without judgment.
I couldn't agree more. We need to let them know that it's okay to feel all the feels, that there's no right or wrong way to experience pregnancy emotionally.
It's about validating their experience and letting them know that they're not alone.
Exactly. And sometimes that might involve offering resources like support groups or connecting them with a therapist.
Right, if they need some extra support navigating those emotions. Now, aside from that initial ambivalence, are there other common emotional threads that we see throughout pregnancy?
As the pregnancy progresses, a lot of women start to feel this incredible connection with the baby growing inside them.
Oh, yeah, that makes sense.
Right. They feel those kicks and movements, and it becomes more real, more like a separate individual. It's really the beginning of that maternal identity, that sense of, I am becoming a mother.
It must be such a profound shift in a woman's sense of self.
It really is. And, that transition to motherhood doesn't happen in a vacuum. It impacts relationships, too, especially with partners.
Okay, so let's talk about the dads-to-be. What are some of the ways that pregnancy affects them emotionally?
Well, just like moms, they experience a range of emotions, too. There's that excitement and anticipation of becoming a father, but there can also be anxiety and fear and, just feeling a bit overwhelmed.
Yeah, it's a huge adjustment for them, too.
It is. And we can't forget about Couveid syndrome.
Oh, right, Couveid syndrome, where the partner starts experiencing physical symptoms that mirror the pregnant woman's symptoms.
Exactly. Things like fatigue, nausea, even weight gain.
It's amazing how interconnected couples can be.
It really is. But beyond the physical stuff, partners are also going through their own identity shift. They're becoming fathers, and that can bring up a lot of questions and uncertainties.
Like, what kind of dad will I be? How will this new baby change our relationship?
Exactly. It's a lot to process.
It is. So what can we do as nurses to support partners during this time?
Well, I think one of the most important things is to encourage open communication between partners.
Communication is key.
Always. It's so important for couples to have that space to talk about their fears, their expectations, their hopes for the future.
And sometimes they might need a little guidance with that communication, like maybe referring them to parenting classes or couples therapy.
Yeah, those can be great resources. And even during those prenatal visits, we can play a role in facilitating those conversations just by providing information, answering questions, offering reassurance.
Right. It's all about creating that supportive environment.
Absolutely. Now, we've talked about partners, but we also need to consider the impact on siblings.
Oh, yes, the other little ones in the family.
I know.
It can be a big adjustment for them, too.
It can. I mean, think about it. Welcoming a new baby into the family is a huge change, especially for young children.
Right. They're not the center of attention anymore.
Exactly. For toddlers, it might trigger regression, wanting to be held or fed like a baby. Older children might exhibit jealousy or resentment or even act out.
Like their whole world is being turned upside down.
Pretty much. So it's important for parents to acknowledge those feelings and to reassure their children that they're still loved and cherished.
Lots of reassurance and extra cuddles.
Exactly. And involving them in the pregnancy as much as possible can help too. Letting them feel the baby kick, helping decorate the nursery, choosing clothes for the baby.
Right, making them feel like they're part of the process.
Exactly. And then once the baby arrives, continuing to prioritize one-on-one time with those older siblings can go a long way in maintaining that bond.
Makes sense. So we've talked about the emotional impact on moms, partners, and siblings. But let's zoom out a bit and consider the broader social context of pregnancy.
Okay. Yeah, that's an important piece of the puzzle.
Because it's not just a personal experience, right? It's also shaped by the society and culture we live in.
Absolutely. Cultural norms, societal expectations, access to resources, all of these things play a role in shaping a woman's pregnancy experience.
For example, in some cultures, pregnancy is celebrated and women are surrounded by support, while in others it's seen as a more private matter.
Exactly. And those cultural beliefs can influence everything from the type of care a woman receives to the level of support she has from her family and community.
And then there are the practical considerations like work and finances.
Oh, yeah, for sure. Pregnancy can have a huge impact on a woman's career, especially if she doesn't have access to paid maternity leave.
It's true. And the financial burden of pregnancy and childbirth can be overwhelming, especially for families who are already struggling.
Right. And that stress can then affect the woman's physical and emotional health, which can then impact the pregnancy itself. It's all interconnected.
It really highlights how important those social support systems are and the need for policies that support pregnant women and families.
Couldn't agree more. Access to affordable childcare, paid parental leave, quality health care, these are all essential.
Absolutely. It's an investment in the future, not just for individual families, but for society as a whole.
Well said. And, this brings us back to our role as nurses.
Oh, yeah.
We have such a unique opportunity to advocate for our patients and to push for policies that create a more equitable and supportive environment for pregnancy and parenthood.
It's about seeing the bigger picture and recognizing that pregnancy isn't just a medical event. It's a social and emotional journey.
Exactly. And by understanding those social and emotional aspects, we can provide more holistic and compassionate care.
Wow, this deep dive has been amazing. We've really explored pregnancy from all angles.
We have. It's been a great discussion.
It has. And I think we've all come away with a deeper appreciation for the complexity and the wonder of this incredible journey.
I agree.
And to all our listeners out there, thanks for joining us on this deep dive into pregnancy. It's been a pleasure exploring this topic with you, and I hope you've learned a thing or two along the way.
Until next time, keep those brains buzzing.